series titled Yes, We Can Reduce Poverty, a Collective Impact Approach. Part one is featuring cities reducing poverty and the Central Iowa story. In just 2 years, nearly 25,000 Central Iowans have become financially self-sufficient in a growing community where 1 in 4 households struggle to afford basic necessities. With a goal to reduce poverty for 75% of the population by 2020, opportunity in Central Iowa is already well into its impact journey. I'm pleased to introduce our speakers for today, Seth Johnson, Helene Fein, and Stephen Lynn.
Thank you everyone for coming out to hear a little bit about what we are doing here in Central Iowa to work to reduce poverty. For those of you who aren't familiar with the Opportunity Program, this collective impact initiative was started 5 years ago. And what we were looking to do is try to remove barriers that prevent Central Iowans from thriving and therefore overall reduce poverty. And since our start, we've always been really focused on data and what we can do to tie our actions to how we're actually moving the needle. I've been in this program for 2 years of the 5 years of our existence, but Helene, who I'm going to turn it over to now, has been with Opportunity since the start and can kind of talk a lot about the data, and then we'll go a little bit more into how data has informed our work and changed with our work over the last couple of years. So Helene, I'm going to turn it over to you.
Thank you, Seth, and welcome everyone. It's great to have the opportunity to talk about something that you're passionate about and something that you are feeling really good about, and that is our opportunity work. So I'm going to be sharing a lot of numbers, and I hope you'll be patient, but this is all about numbers. Even small changes in data can show that you're making a difference in the work that you do. So if we could look at the next slide. Population changes.
You might have lost that slide.
Okay, so it appears as if that slide is somewhere. I do want you to know that the total population of Iowa has increased by over almost 86,000 people since 2011. So that's a big change because Iowa is not a huge state. In Central Iowa, the population has increased by close to 61,000 people. That's over an 11% increase since 2011. A couple of notable changes about population. The Black or African American population has grown almost 21%. The Asian population has grown almost 39%. The senior population, ages 65 plus, has grown 25%. Individuals 18 and under has grown almost 10%, and individuals 18 to 64 has grown 9.6%. So that's it. These numbers are important because for many years our population was static, and it's nice to see that our communities are growing, our state is growing, particularly in the area of minorities. We have a fairly large refugee population in Central Iowa, which most people wouldn't guess. We also have refugees who come here, go through one winter, and then decide they're leaving because they're not used to the cold. But we do maintain a fairly large refugee and immigrant population. So the table you're looking at is pretty important to the work that we do because we categorize in 4 areas: extremely poor, very poor, low income, and self-sufficient. In the extremely poor area, that's less than 100% of the federal poverty level. On the other end of the chart, 250% and above is what we consider self-sufficient. At that point, you are fairly independent of public assistance, whereas in the other 3 categories, you will be receiving some public assistance, or at least you're eligible for some. So this chart also is important in the sense that the 2 middle columns are probably people who are working. There are people working in the extremely poor column. So we have an issue with working poor because Iowa is a fairly low-wage state, And that's a great concern because people work hard, they pay taxes, but they really can't afford to keep their heads above water. Now, if you look at the percentages from in 2015, 16, and 17 at the lower part of the chart, you will see that the number has gone down in the areas of poor, low income has gone down, and the percent of self-sufficient has gone up. This is an indication to us that something is happening, even considering our growing population, that there is a change in the percent of people living in poverty. And that puts a smile on our faces because it means that we are making a difference. Just a little bit more clarification, we use 250% of the federal poverty level as our definition. It's estimated at that point that you have what is necessary to survive and maintain a basic budget. It doesn't really mean that the family that is at that percent is thriving. There may be no vacations, no birthday parties, education expenses may be difficult, they may not be able to eat out, entertainment is at a minimum, they may struggle with loan payments. So 250% is surviving, but it isn't necessarily thriving. So United Way of Central Iowa has community goals in education, income, and health. And the one that is most relevant to our conversation today is our income goal, which is to increase the percentage of Central Iowans who are financially self-sufficient to 75% by the year 2020, which is coming very quickly. Now, what is interesting to note is that right after this goal was set, we were hit with a huge recession, which made for great struggles in the income area for many people in our state of Iowa. There were many more people unemployed for a while. People were really struggling. So any improvements that we are seeing now are very encouraging. We are reluctant to say that we're going to meet that goal of 75% financial self-sufficiency by 2020 because of the recession, but we are finally seeing a turnaround, which is very encouraging. Since last year, almost 14,000 more people are in that area of being financially self-sufficient, and in the previous year, a little more than 11,000 people were more financially self-sufficient. So the two-year total we're looking at is that there are almost 25,000 Iowans who are financially self-sufficient. That's a huge number to think of those people not having to struggle quite so much anymore. We're also seeing the number decrease by almost 3,000 of those people in Central Iowa living below 100% of poverty. And we're seeing since 2011, over 40,000 more people are financially self-sufficient. So I don't know whether you would define this as success, but we certainly do. So why is there the change in the numbers? The first thing is there has been a very strong commitment, particularly in the last 5 years, of the Central Iowa community to remove barriers to financial self-sufficiency. Opportunity and other collaborative work has happened and has brought people together to address critical community issues that are causing people to live in poverty. While we did experience an increase in the self-sufficiency rate, we do still have critical challenges, with 1 out of 3 people in our 3-county area who are not financially self-sufficient. So there's work to do. We don't want in any way to create the impression that we are going to rest on our laurels, because we are not. We're just beginning to believe that what we're doing can make a difference, and we want to keep making that difference.
And so I think that is a great high-level overview of some of the data, but in the states that we really struggle with is our definition of poverty. Is that in the 1960s is when we had our first initiative to really start to define poverty, and we haven't really done a lot to change that or to update it in the United States. And so what we've done here in Iowa is that we were part of a United Way initiative where we look at poverty is much more of a spectrum, going back to that first slide that Helene talked about. And we know that there are people who are these ALICs, which are asset limited, income constrained, and employed. And that in the United States of an individual living in poverty and being employed is a very hard disconnect. People think that if you're employed, you should be able to cover all of your household needs. And so we were able to, with our United Ways of Iowa, which is kind of the collaborative of all the United Ways in our state, we're able to better understand who the individuals are here in Iowa who fit into this, what we call ALICE bucket. And so ALICE is an acronym, as I mentioned, that represent all those who are in our community that are asset limited, income constrained, and employed. And she's not an individual, but it's more of a concept. It's blending of all those in our community that bring home that paycheck, but doesn't stretch to cover our basic needs. And again, as I mentioned, this is a real rub with how we understand poverty in the United States. So what the key findings from our most recent ALICE report is that over 450,000 Iowa households, or 37% of our state, struggle to afford basic household expenses. That ALICE households comprise nearly 26% in Plymouth County, which is one of our more rural counties, and then 52% of another one of our counties in the state of the population in an Iowa county. More than 40% of our senior households in Iowa fall below the ALICE threshold. It means that we definitely have a lot of seniors that are fixed income, but really not able to afford everything that they need. Over 100,000 households with children fall below the ALICE threshold. That means nearly 1/3 are in two-parent homes. It means that we just have tons and tons of kids that are really that are in households that are struggling to get by, which then puts an overall strain on our education system as well too. The average annual household survival budget for a four-person family in Iowa is $56,772. That's more than double the federal poverty level in our state. That really gets to what I talked about earlier, is our outdated definition of poverty. I know that in Canada, there's a lot of debate around your poverty level and your poverty line and some of the changes with that. Ours is just so outdated that we have to double it to even get close to what a family might need to be able to survive. We did see something that's interesting, and something we've tried to been focusing on in the last year, is that childcare represents the family's greatest expense. When we established the federal poverty level in the United States, food was the largest household expense for families. That hasn't been true in a very, very long time in our state, and childcare had just surpassed housing actually as the largest family expense. And 66% of the Iowa jobs pay less than $20 an hour. More than half of those pay less than $15 an hour. And $15 an hour for full-time is $30,000. Now, our minimum wage in the state of Iowa is $7.25 an hour. And so half of that is what is state mandated for what you can pay people. So we have a very, very long ways to go to getting more of our Iowa families financially self-sufficient. So this gets into what we've really done in the last couple of years with Opportunity, is that all of this data feeds into what we need to be doing to address poverty and how we need to be doing that. But at the same time, you guys just went through our presentation. That data gets really overwhelming really fast. And also saying that, hey, you're going to reduce poverty to a lot in our community was very overwhelming. Poverty is extremely complex. I don't have to tell anyone on this webinar that. But it's hard to see how you can have impact on poverty reduction when you see the numbers going the wrong way, as we did for a long time in our history. And so that's where we pivoted. We decided that we can still talk about poverty reduction at a high level, but our day-to-day work needs to switch. Our day-to-day work needs to be tied to data and needs to be tied to barriers that are preventing Central Iowans from thriving. Those barriers can range from a lot of different things, but we need to focus on barrier reduction, barrier elimination, not necessarily poverty reduction day in and day out. So these barriers, it meant that we were able to draw from the tool that we have, which we call our opportunity scorecard. What our scorecard is different data points that kind of fit within our work groups. So in opportunity, we have 8 different work groups. As some of our partners, these are our action teams that focus on different things. And within each one of those 8 work groups, we have different data points that we're trying to impact and make change. Essentially, we have different barriers that we're trying to change the numbers around. And so what does that look like? So if I'm going to pull out one example. So the number of SNAP recipients in Polk Warren and Dallas County. So in the United States, SNAP is Supplemental Nutrition Assistance Program, or this is your food stamps. This is where you can you can apply for the program and be a part of it. What we've seen over the last, since 2014, we've seen the number of people that are participating in SNAP decrease. Well, why is it decreasing? We know that the need is not decreasing. We know that the need's almost remaining the same, but we've almost seen the number of people that are using SNAP decrease by 10,000 people. Well, why is this? And so we saw that barrier, and our action team decided that they wanted to do something about it. And so our work group set out to tackle this data point and eliminate this barrier. We need more people to be signing up for food assistance. Now, there's a lot of things that go into this. A lot of the national debate around undocumented immigrants could feed into this. We know that our new Iowan populations are really scared of accessing government assistance right now in the United States, but we need to do more. And so that's what our team did, is that our team went out and they started to work with different partners to go out and try to get them to do it. And what culminated is that actually our local food bank hired an individual whose sole job is to go out and get more people signed up for SNAP. And so it's a pretty good success for us, is that we were able to do that. And so if we talk about this on a kind of a spectrum, this is what it looks like, is that in the structure of opportunity, the poverty reduction work, we kind of leave that up to our opportunity council and our opportunity staff. So there's 2 of me. So there's myself and then Natalie, who works with me as well too. It's our job to make sure that those barriers are feeding into poverty reduction. And our council does that on a community level to continue to check us. Our food insecurity work group is the one that has been going through the data and saying, hey, what are the things that we want to impact? Our action team is saying, hey, these are the pieces. And then after that, we have a smaller group that gets together that says, okay, this is our plan to tackle this barrier. And so that's how we have shifted from doing large poverty reduction work to really focusing on day-to-day. These are the barriers that are preventing people from thriving, that is tied to data, and this is what we're going to do to change that. So this is just one example of a couple hundred examples that we almost have at this point with our new updated plan of how we've switched of how we talk about poverty reduction, how we talk about barrier elimination, but how data is tied to every single piece of this, is that we're not choosing these barriers without being able to tie it to a data point we're trying to move. So that kind of is where we have been and where we are now headed as well too. What's really exciting about doing this focus on barrier elimination is that it allows your action teams to refresh what they're focusing on more regularly. And so actually we released our updated plan a year ago now. And right now, majority of our work groups are going through the process of setting new goals and picking out new barriers that they want to eliminate. This means we can capitalize on momentum that we're building. As we start to get these programs, these pieces, these advocacy portions up and running, and we start to see these barriers eliminated, we can celebrate that success, but then move on and capitalize and start the momentum again to focus on another piece. And so that's been really fun for us, and how we've really just said that, yes, we can reduce poverty. We can reduce poverty by focusing on these barriers and getting our community to rally around small pieces that can lead into a large overall